Hello, today I'm going to talk about public speaking anxiety. Mastering public speaking skills empowers one to communicate complex ideas and information in such a way that each member of the audience can understand the message. However, one of the challenges to mastering these skills is public speaking anxiety, also commonly referred to as public speaking apprehension. According to Richmond and McCroskey, communication apprehension, defined as the fear or anxiety associated with either real or anticipated communication with another person or persons, is one of the most crucial factors contributing to lack of effective communication. They categorized communication apprehension into four types, namely trait-like apprehension, context-based apprehension, audience-based apprehension, and situational apprehension. Public speaking apprehension falls under the category of context-based communication apprehension. Prebill, Keaton, and Sakamoto proposed that public speaking anxiety may result from several causes, such as perceived lack of public speaking skills, emotional predispositions towards public speaking, and characteristics of the public speaking situation itself. Researchers and scholars have postulated that some of the main methods for reducing public speaking anxiety include systematic desensitization. It is a form of behavioral therapy involving a process that desensitizes a person's feelings and emotional reactions to public speaking by using positive visualization and encouraging the person to relax when contemplating a particular speaking event. Another method is cognitive restructuring, also known as cognitive modification. It is a process that identifies negative thoughts or illogical beliefs, then replaces them with positive ones or formulate new and more appropriate beliefs. Finally, skills training. Skills training is based on the simple principle that the better one knows how to do something, the less anxious one will feel about doing it. Authorities in the area of public speaking concur that a combination of the three intervention methods is more effective in alleviating public speaking anxiety than any single method. However, Richmond and McCroskey suggest that skills training is constructive if the individual's high apprehension concerns only one type of communication context, for instance public speaking, and the said individual has deficient skills in that area. In skills training for public speaking, the speech-making process is divided into specific skills that can be mastered first in isolation and then together. Educators from the Greek and Roman academies divided the entire process into 5 major categories, providing principles and guidelines that students need to master in order to become effective orators. These categories and the principles within them are called the 5 canons of rhetoric, encompassing first the canon of invention. This canon pertains to principles for designing a speech that meets the needs of a specific audience, for example, audience analysis, selecting and narrowing the topic, determining the purpose, developing the central idea, and gathering materials. Next is the canon of disposition or arrangement, containing guidelines for organizing a speech so that the ideas connect logically and flow coherently. The canon of style comprises principles for selecting effective language that is best suited to the audience and the occasion. Fourth is the canon of memory, often called the lost canon. Ancient orators developed extensive principles for memorizing speeches because they did not have the aid of technology to cue memory. In contemporary public speaking, the principles in this canon has been superseded with those related to preparations for different methods of delivery, for example, impromptu, manuscript, memorized, or extemporaneous, and the practice or rehearsal of the selected delivery method. The last canon of delivery consists of rules or standards for presenting the speech with poise and polish. For the next few weeks, we will experience each of the steps in the speech-making process.